Gentlemen, if you're over 60, this message is especially for you. You've likely heard all sorts of stories about masturbation, some comforting, others confusing. But what if I told you that doing it every day could actually affect your prostate?
I've spent years helping men just like you navigate this stage of life with confidence, and today I'm sharing what the science really says. Trust me, this could change how you think about your daily routine and your long-term health. Let's talk about it. Let's start with something most men don't often think about: the health of your prostate fluid. The prostate is a small gland about the size of a walnut located just below the bladder. One of its main jobs is to produce a portion of the fluid that makes up semen. This fluid helps nourish and protect sperm. But here's the part many don't know. When semen stays in the prostate for too long, it may cause problems over time, especially as we age. Now think of your prostate like a little factory. It's constantly producing fluid, even if you're not sexually active. If that fluid isn't released regularly, it can build up and become stagnant. Just like standing water in a pipe can start to smell or clog, stagnant prostate fluid can lead to irritation or inflammation within the gland. Over time, this may increase the risk of developing discomfort, swelling, or even infections. This is where daily ejaculation, whether through sex or masturbation, can play a helpful role. By ejaculating regularly, you're essentially flushing out the old fluid and helping your prostate stay clean and functional. For many men, this simple act keeps the plumbing working smoothly. There's even some research suggesting that frequent ejaculation may reduce the risk of certain prostate issues. In one large study, men who ejaculated more often in their later years had a lower risk of prostate cancer compared to those who ejaculated less frequently. While scientists don't fully understand every reason behind this, the cleansing effect of releasing prostate fluid regularly seems to play a part. Now, this doesn't mean you have to masturbate daily. Everyone is different, and your comfort level, medical history, and lifestyle matter. What's important is knowing that staying sexually active, even just for prostate maintenance, isn't something to be ashamed of. In fact, it may be a simple and natural part of keeping your body healthy. It's also worth noting that this isn't about performance or pressure. Even gentle stimulation or regular release a few times a week can offer some of these benefits. If you've had prostate issues in the past, it's always wise to speak with your doctor before making changes to your routine. But for many men, daily ejaculation is a healthy and safe practice. In summary, your prostate likes to stay active, just like the rest of your body. Letting it do its job and regularly clearing out the fluid it produces may help reduce discomfort, improve long-term prostate health, and possibly even lower the risk of disease. It's a small habit that can make a big difference as you age, quietly supporting your wellness in the background.
As we age, one of the most common issues men face is prostate inflammation, also known as prostatitis. This condition can cause discomfort in the lower pelvis, frequent urges to urinate, painful urination, or even pressure in the groin area. For many older men, this becomes an ongoing concern that affects daily life, sleep, and peace of mind. What some don't realize is that daily masturbation may actually help manage and reduce this inflammation in certain cases. Here's how. When the prostate isn't emptied regularly through ejaculation, it can lead to a buildup of fluid, bacteria, or inflammatory substances inside the gland. Over time, this stagnation may irritate the prostate and contribute to swelling or infection. Think of it like dust collecting in an unused room. Without movement and flow, things tend to settle and build up. Ejaculation, especially on a regular basis, helps move things along. It allows the prostate to release the fluid it's been producing, which can clear out irritants, reduce pressure, and support better circulation in the area. For some men, this routine flushing of the system can lead to less swelling and more comfort over time. In fact, some urologists recommend regular ejaculation as a natural strategy for managing mild cases of chronic prostatitis. It's not a cure-all, and it certainly doesn't replace medical care when needed, but it can be a helpful part of your prostate self-care routine, just like walking is good for your heart or stretching helps your joints. It's important to understand that inflammation in the prostate isn't always caused by infection. Many times, it's simply due to poor drainage, tension in the pelvic muscles, or hormonal shifts that happen with age. In these cases, regular ejaculation can gently ease that pressure and keep things working more efficiently. Now, a word of caution: if you're dealing with pain, fever, or a known prostate infection, don't try to manage it on your own with masturbation. That's a situation that requires a doctor's care. But if you're healthy and experiencing occasional discomfort or sluggishness down there, Keeping a regular release schedule may be one simple way to help prevent future flare-ups. What matters most is consistency and comfort. You don't need to aim for daily if that feels like too much. Just maintaining a regular pattern that feels right for your body is what counts. And if you're ever unsure, a quick check-in with your urologist can help guide your decision. In short, daily ejaculation can support your prostate's natural health by reducing inflammation and swelling, especially when it's done gently and as part of a healthy routine. It's another example of how understanding your body and working with it, not against it, can lead to a better, more comfortable life as you age. As men grow older, one of the biggest changes that naturally occurs in the body is a gradual drop in testosterone levels. This hormone plays a major role in maintaining energy, mood, muscle strength, and, yes, even prostate health. But what many don't realize is that regular sexual activity, including masturbation, may help keep your hormones a bit more balanced as you age. Now, let's be clear. Daily masturbation doesn't suddenly increase your testosterone levels like a magic switch. However, research has shown that sexual arousal and regular ejaculation can temporarily raise testosterone levels, even if just for a short while. And over time, this regular stimulation may help support a more stable hormonal rhythm, especially when done consistently. Think of it like this: your body responds to activity. Just as walking helps maintain your joints and muscles, regular sexual release can keep your hormonal system engaged and responsive. It's a gentle reminder to the body that this part of your health still matters. For older men, this can be important because low testosterone levels are often linked to fatigue, depression, low sex drive, and even prostate issues. While daily masturbation isn't a replacement for medical treatment or hormone therapy, it may play a helpful, supportive role in maintaining your body's natural rhythm and balance. Another important hormone affected by regular ejaculation is prolactin. After ejaculation, the body naturally releases prolactin, which contributes to feelings of relaxation and satisfaction. This helps with stress relief and may even improve sleep, two things that directly impact your overall health, including your prostate. Some experts also believe that maintaining a healthy sexual routine into older age may help regulate the balance between testosterone and estrogen in men. Yes, men also have small amounts of estrogen, and when testosterone levels drop too low, that estrogen can become more dominant. That imbalance may play a role in prostate enlargement or other hormone-sensitive conditions. In short, daily masturbation, if comfortable and healthy for you, may help your body maintain a gentle hormonal balance that supports not just prostate health, but also emotional well-being and energy levels. Of course, every man's body is different. Some may feel fine with less frequent ejaculation, and that's okay too. The key is to be in tune with your body and to understand that sexual wellness is part of overall wellness, especially in your senior years. If you ever feel like your hormones are off, low energy, lack of motivation, poor sleep, it's always a good idea to talk to your doctor. But know this: your body is still active, still responsive, and still capable of benefiting from healthy sexual habits. You're not past your prime, you're simply in a new stage that deserves just as much attention and care. As men reach their 60s and beyond, one of the most common health concerns they face is benign prostatic hyperplasia, or BPH, also known as prostate enlargement. This condition isn't cancerous, but it can cause real discomfort. You may notice more frequent trips to the bathroom, weak urine flow, or a feeling that your bladder isn't fully empty. If this sounds familiar, you're not alone. BPH affects more than half of men over 60. Now here's where daily masturbation may come into play. While it can't prevent BPH entirely, regular ejaculation may help support a healthier, less congested prostate, possibly reducing the chances or severity of prostate enlargement. Let's break it down simply. Your prostate continues to produce fluid throughout your life. If that fluid isn't regularly released, it can cause the gland to become backed up or congested. Think of it like a sponge that's soaked with water and never squeezed out. It becomes bloated, heavy, and over time it may lose its flexibility. Similarly, the prostate may become larger, stiffer, or more inflamed when it's not emptied regularly. Regular ejaculation is like gently wringing out the prostate. It helps reduce pressure, clear out excess fluid, and promote good circulation in the area. For some men, this regular flushing action may support a more relaxed and better functioning prostate. There's also the issue of muscle tone and blood flow.
The act of ejaculation engages the pelvic floor muscles and encourages blood to flow in and out of the prostate and surrounding tissues. This kind of natural activity can help the prostate remain healthy and resilient, much like how light exercise keeps your joints and muscles flexible. Some studies suggest that men who ejaculate more frequently may have a lower likelihood of developing severe urinary symptoms, which are often linked to an enlarged prostate. While more research is needed, the idea is that regular sexual activity may help keep the gland from becoming too stagnant or swollen. However, it's important to keep expectations realistic. Masturbation is not a cure for BPH, and it won't shrink an already enlarged prostate. But for many men, it can be a small but meaningful part of their prostate care routine, something easy, natural, and safe to do regularly to support overall function. If you're already experiencing symptoms of BPH, such as frequent urination, trouble starting your stream, or nighttime bathroom visits, it's best to speak with a urologist. There are many treatment options available, from lifestyle changes to medications. But understanding how regular ejaculation fits into the picture can give you one more tool in your wellness kit. In summary, daily ejaculation may help reduce fluid buildup and support the health of your prostate as you age, possibly lowering your risk of prostate enlargement or easing some of the discomfort that comes with it. It's a gentle habit that aligns with your body's natural design, and one worth considering as part of a balanced approach to senior men's health. One of the most serious concerns many older men have about their prostate is the risk of prostate cancer. It's the second most common cancer in men worldwide, and while it often grows slowly, early prevention is still very important, especially after age 60. Now here's something you might not expect. Daily ejaculation through masturbation may actually help lower the risk of developing prostate cancer. That's not just a guess. It's backed by several scientific studies that have shown a connection between regular ejaculation and reduced prostate cancer risk. Let's look at one of the most well-known studies. A long-term research project from Harvard followed thousands of men over many years. The results showed that men who ejaculated at least 21 times per month, that's about every day, had a significantly lower risk of developing prostate cancer than those who ejaculated less often. Why might this be the case? One leading theory is that ejaculation helps flush out potentially harmful substances from the prostate. Just like regular oil changes keep a car engine running clean, ejaculating may help clean out the prostate by getting rid of old fluids, waste materials, or toxins that could otherwise build up over time. This regular clearing may reduce the chance of cell damage or abnormal growths forming inside the gland. Another possible benefit is that regular sexual activity helps the prostate stay active and healthy. When the gland is consistently stimulated and emptied, it keeps blood flowing and supports healthy tissue function. In contrast, a stagnant prostate, one that isn't used regularly, may be more prone to inflammation, cell changes, or even the early development of cancerous cells. Of course, it's important to understand that masturbation alone cannot guarantee cancer prevention. It's just one of many factors. A healthy lifestyle, like eating nutritious foods, staying active, avoiding smoking, and getting regular checkups, plays a major role too. But daily ejaculation may be a natural and easy habit that contributes to your overall prostate health. It's also worth noting that this doesn't have to be a stressful routine. If daily ejaculation feels like too much, that's okay. Even a few times a week may offer benefits. The key is consistency and comfort, working with your body, not forcing it. And if you have a family history of prostate cancer or any concerns about your risk, be sure to speak with your doctor. Early detection through screening, like the PSA test, is still the most powerful tool we have for catching prostate cancer early, when it's most treatable. In summary, regular ejaculation, whether through sex or masturbation, may help reduce your prostate cancer risk by keeping the gland clean, active, and less prone to harmful buildup. It's a simple, natural part of a well-rounded prostate care plan, and one that many men can easily include in their daily health routine. As men get older, two of the most common health concerns they face are changes in urinary habits and sexual performance. These changes can feel frustrating, uncomfortable, or even embarrassing. But the good news is, certain daily habits may help support both areas of your health. And yes, one of those habits is regular ejaculation through masturbation. Let's start with the urinary system. Your prostate gland sits right below your bladder and wraps around the urethra, the tube that carries urine out of your body. When the prostate becomes enlarged, irritated, or congested, even slightly, it can press against the urethra. This leads to common symptoms like slow urine flow, urgency, frequent nighttime urination, or the feeling that your bladder isn't fully empty. Daily ejaculation may help relieve some of this pressure by keeping the prostate active and cleared out. Think of it like letting water flow through a pipe regularly, keeping it from clogging or building up pressure. When the prostate releases its fluid more often, it may reduce swelling or congestion in the area, making it easier for you to urinate more freely and comfortably. Now let's talk about sexual function, another area that can be affected with age. Many older men notice changes in erection strength, stamina, or interest in sex. While this is completely normal, staying sexually active, even with solo activity like masturbation, can help keep those systems responsive. When you engage in regular sexual activity, you stimulate blood flow to the pelvic region, including the penis and prostate. This increased circulation helps maintain tissue health and nerve sensitivity, which can support stronger erections and more satisfying sexual experiences over time. Just like walking keeps your legs in shape, regular sexual stimulation can help your body stay in tune sexually. Daily ejaculation may also have a positive impact on your mood and stress levels, which are directly linked to sexual function. After orgasm, your body releases feel-good chemicals like dopamine and oxytocin, which help you feel more relaxed, sleep better, and reduce anxiety, factors that also influence urinary and sexual health. And let's not forget, confidence matters. When you feel in control of your body, whether it's through managing your urinary routine or keeping your sex life active, you're more likely to stay engaged, healthy, and emotionally balanced. That said, daily masturbation is not a one-size-fits-all solution. If you're dealing with serious urinary issues or erectile dysfunction, it's always wise to consult a urologist to explore medical options. But for many older men, regular ejaculation can be a natural, safe, and effective way to support both urinary ease and sexual vitality. In summary, by keeping the prostate functioning regularly, daily ejaculation may help reduce urinary symptoms and preserve sexual health, making it an easy yet meaningful habit to consider as part of your everyday wellness routine. Now that you know how something as simple as daily masturbation can impact your prostate, I hope you feel more informed and more empowered. If this video helped clear up some confusion or gave you something to think about, please give it a thumbs up and share it with a friend or loved one who could use this guidance. And if you haven't already, hit that subscribe button and turn on notifications. I'm here every week with real, honest health advice just for you. Your health matters. You deserve to feel your best.